Hello, I am Butalid, she, her, and I am a first year human biology and society major.
Hi, my name is Kayla, she, her. I'm a first year public health major.
Hi, my name is Danibel Kasbari, he, him. I'm a third year psychobiology major.
Hello, my name is Niki Shiva, she, her, first year public health major.
Hi, my name is Melia Kenny. I'm a fourth year, she, her, and I'm a global studies and public health major.
Hi, I'm Leah Wildmann, she, her. I'm a fourth year psychobio major and global health minor. We are from Bruins Public Health and are under the guidance of Dr. Zhu from Fielding School of Public Health. Today we are presenting Covered but Still Confused, a qualitative study on health insurance and care use among college students.
At the University of California, all students are required to have health insurance to enroll. Most students are automatically enrolled in a standardized student health insurance plan offered across all UC campuses, known as UC SHIP. But here's the issue. Prior research shows that college students often have low health insurance literacy. In other words, they don't always understand how their coverage works, how to use it, or even the basic vocabulary of healthcare systems. This lack of understanding can directly impact their ability and willingness to seek care. Our project was inspired by a previous study that explored the experiences of low-income UC students navigating insurance choices. The findings highlight just how complicated this process can be, especially for first-generation students or those from socioeconomically disadvantaged backgrounds. This is because they often lack support during the UC SHIP waiver process and face real barriers to accessing care, especially when they rely on Medi-Cal or private insurance. In our study, we hypothesized that students instead make decisions about their health insurance and healthcare utilization that are not intentional or well-informed, often deferring this decision to their parents or guardians. Additionally, we estimate that non-UC SHIP students that have private insurances are also less likely to seek healthcare for reasons such as convenience, lack of knowledge about coverage, difficulty finding in-network providers near campus, and the overall assumption that campus health services such as the Arthur Ashe Clinic are only for UC SHIP users.
As stated in the background section, college students tend to have poor health insurance literacy, which is correlated with low rates of healthcare utilization. This confusion can make navigating the healthcare system intimidating and possibly causing delays or complete avoidance in seeking health treatments, leading to poor health outcomes. Through interviews and qualitative analysis, the aim of our study is to analyze student experiences, barriers, and perceptions around healthcare access and insurance use. Our goal is to identify real gaps in insurance literacy so that we can provide students with the knowledge and tools they need to take control of their health. In the end, we aim to corroborate our findings with the university to expand access to resources, improve communication around health insurance, and develop more inclusive support systems that meet the diverse needs of all students while contributing to better health outcomes on campus.
Our participants were 12 undergraduate UCLA students that we recruited across campus. For recruitment, we used purposive sampling to ensure diversity and representation across demographics, including race, year in school, and type of insurance used. We collected data through in-person, semi-structured interviews that we recorded. The interviews were transcribed and then analyzed using a deductive thematic approach. In our analysis, we were looking at how and where students acquired and used healthcare and why students made these utilization and acquisition decisions.
Through the analysis of interviews, we identified patterns in healthcare seeking behavior among externally insured students. These patterns included waiting to schedule routine and preventative care visits until break to meet with primary care providers at home, greater vulnerability in term due to restricted access to healthcare services on campus, unfamiliarity with UCLA providers, and fear of out-of-pocket costs. A higher affinity for out-of-network providers to prioritize convenience and accessibility in an academically rigorous environment, and delaying care until absolutely necessary, remediating symptoms and small ailments with over-the-counter substitution. Furthermore, thematic analysis of interviews revealed 5 major themes regarding health insurance acquisition and healthcare utilization among undergraduates.
We found that when it comes to decision making, college students highly prioritize the convenience and accessibility of healthcare services, even among other decision making factors related to health insurance and healthcare. Sometimes students may even choose to access out-of-network providers near UCLA during the academic year, prioritizing convenience and timely appointments over out-of-pocket costs. Next, participants often described how their pre-college healthcare behaviors persisted during their time at UCLA. For example, students whose parents emphasized the importance of preventative care, especially through routine childhood visits, often continued those practices in college. In addition to reliance on personal and parental experience, participants also expressed a reliance on a mixture of telehealth and in-person resources to navigate information regarding the cost and types of coverage included in their health insurance plans. Yet, while being aware of the healthcare services and health insurance benefits available to them, students expressed deprioritizing seeking healthcare amid competing student priorities. For instance, when experiencing cold or flu symptoms, students reported waiting for their symptoms to reside, or until symptoms became too severe to delay care further. And lastly, interview with participants expressed how feelings of trust influenced healthcare acquisition behaviors. For students familiar with providers near UCLA, they were more confident regarding their healthcare decisions and are more likely to seek routine or preventative healthcare services. In contrast, students with past negative experiences with providers at or near UCLA, or without knowledge of providers near UCLA, may be hesitant to seek out healthcare or unenroll.
Results highlight the various barriers that prevent college students from acquiring and utilizing healthcare services. However, further research is needed to examine how specific demographics impact undergraduate health literacy and efficacy, such as by increasing demographic diversity in our sample size, like race, insurance types, etc. By recognizing a need for more health literacy resources, we hope to utilize our research to advocate for greater educational and more accessible health insurance resources, such as workshops discussing health insurance and more pay transparency when it comes to acquiring and utilizing UC SHIP health services. Overall, our research advocates for additional support from the university to increase the health outcomes of college students and young adults as a whole. Here are our references, and thank you for listening.